eyes express the feelings of the heart, mind, and soul. It shows love, calmness, anger, sadness, happiness, and so forth. If a baby is deprived of this, either due to neglect, ignorance, or lack of medical advice, it is our duty as responsible doctors to spread awareness to the general public, especially in our country to the rural villages, to dispose of myths, superstitions, calm fears, and instill in them the importance of ROP. ROP, the abbreviation of retinopathy of prematurity, is the major cause of blindness in babies who are either born prematurely or are underweight.
Retinopathy of prematurity or ROP is a disease which can affect the vision of preterm babies. Lower the gestational age and lower the birth weight of a child, higher the risk of this disease. To detect this disease, screening has to be started within 1 month after the child's birth. And screening has to be done by an ophthalmologist who has to be trained in it.
The reason for this detrimental disease is the abnormal growth of blood vessels in an infant's eye. Blood vessels generally grow from the central part of the retina outwards. This process is usually completed before the normal time of delivery, 280 days or 40 weeks of gestation. However, in premature babies with low birth weight, the growth of blood vessels is incomplete and the vessels grow and branch abnormally. The incidence of ROP in India is between 38 and 51.9%, and it is as high as 80 to 100% in infants weighing less than 900 grams at birth or with a gestational age of less than 25 weeks.
According to World Health Organization, India has the highest number of preterm deliveries in the entire world. So we have a huge burden to do the screening for this disease. Moreover, there are not many trained ophthalmologists who can handle this, especially in rural areas where the government of India has started SNCUs in every district hospital.
The paradox being that with improved NICU care, the incidence of ROP has in fact increased. Unfortunately, there is no proportionate increase in awareness among the medical fraternity in a vast country like India. In the absence of an effective strategy, an increasing number of babies who could have been successfully managed are going irreversibly blind. The socio-economic burden of such childhood blindness is immense. To counter this pathetic situation, Aravind Cbe system is working on a strategy to extend their helping hand to babies who are born prematurely in government hospitals as well as to their parents. This project, termed ROP SOS, Retinopathy of Prematurity Eradication, Save Our Sight, involves tele-screening. Here, a mobile team of trained technicians and sisters visit government hospitals to screen premature babies with a birth weight of less than or equal to 2,000 grams or a gestational age of less than or equal to 36 weeks. Babies with severe illnesses in perinatal period like RDS, sepsis, apneic episodes, etc. will be also covered. The retina fundus pictures will be captured by the RedCam machine, and the same will be immediately transmitted via broadband internet to the base hospital, and the qualified pediatric retinal ophthalmologist will report the case, and a report will be given to the patient at the rural site. Special care would be taken to follow the 30-day strategy in which the retinal examination would be completed at or before 30 days of life of the baby. Arvind's ROP SOS team would take extra care to educate the parents of the patients about the required treatments in order to reduce the chances of unfavorable disease or loss of vision.
എൻ്റെ പേര് സുധീഷ്, ഭാര്യൻ്റെ പേര് ശ്രീജ. നമ്മൾ കൊഴിഞ്ഞാമ്പാറ പെരുമ്പാറ സ്ഥലത്താണ് വരുന്നത്. ഭാര്യയ്ക്ക് 7 മാസത്തെ പ്രസവമായാലും കുഞ്ഞിന് വെയിറ്റ് ഒരുപാട് കുറവായിരുന്നു. വെയിറ്റ് കുറവായിരുന്നു. ഇപ്പോൾ പ്രസവിച്ചിട്ട് 53 ദിവസമായി. പ്രസവിക്കുമ്പോൾ 900 ഗ്രാം ഉണ്ടായിരുന്നുള്ളൂ. ഞങ്ങൾ ആദ്യം ഫസ്റ്റാണത്, കുഞ്ഞ് ഫസ്റ്റാണ്. അവിടെ കണ്ണ് ടെസ്റ്റ് കാണിച്ചു. ചെറിയ പ്രോബ്ലം ഉണ്ട് പറഞ്ഞിട്ട് ആദ്യമായിട്ടാണ് ഈ അരവിന്ദ് ഹോസ്പിറ്റലിൽ ഞങ്ങൾ വരുന്നത്. ഇപ്പോൾ ട്രീറ്റ്മെൻറ്റിന് വരെ വെയിറ്റ് ചെയ്തിരിക്കുകയാണ് ഞങ്ങൾ.
Milder forms of ROP may require only close observation and may resolve on its own without any active intervention. Depending on the severity, medical treatments in the form of lasers, intravitreal anti-VEGF injections may be needed up to stage 3. Surgical intervention would be advised and carried out once the disease crosses stage 4 and 5. The parents will also be advised about lifelong follow-up and rehabilitation that is required after the initial treatment. All premature babies, irrespective of having ROP, are advised yearly follow-ups till the age of 5 years to rule out other sequelae of premature infants like refractive errors, strabismus, amblyopia or lazy eye, retinal detachment, glaucoma, etc. All treatment is being carried out free of cost by the Aravind Eye Care System. Apart from this, ROP SOS also has awareness CMEs in various districts at regular intervals to educate not only the local doctors, pediatricians and ICU staff, but also the relatives of patients and the general public.
Timely treatment can save these children going from permanently blind, and so there is a need of increasing the awareness of this disease, especially amongst the general public, the mothers, the pediatricians, ophthalmologists and the neonatal nurses.
என் பேர் லதா, ராசிவத் பக்கத்துலேருந்து வையப்பமலையிலேருந்து வரோம். தம்பி கோயிலா சேகரில் தான் ஆப்ரேஷன் பண்ணி எடுத்தது. 750 தான் இருந்த வெயிட்டு. ஈரோடு ஜிஹெச்சில் ஐசி வார்டில் 1 வாரம் வச்சுருந்தோம். இங்கே அரவிந்த் ஹாஸ்பிட்டல்லேருந்து அங்கே கண்ணுக்கு செக் பண்ண வந்தாங்க. அங்கே கண்ணில் பிரச்சனை இருக்குதுன்னு சொன்னாங்க. அதனால் அங்கே வந்து 3 மாதம் பார்த்தோம். அங்கே தம்பி பெருசானால அங்கே மிஷின் வேலை செய்யாதுன்னாங்க. அங்கேருந்து அரவிந்த் ஹாஸ்பிட்டலுக்கு இங்கே அனுப்பிச்சிட்டு அங்கே கண்ணுக்கு வந்து ஊசி போட்டாங்க, பார்வை தெரியுன்னு. இங்கே ஊசி போட்டதுக்கப்புறம் பார்வை இப்போ நல்லா தெரியுது, இப்போ நல்லா பார்க்குறான். இன்னும் 1 மாதம் கழித்து வர சொல்லியிருக்காங்க.
So, as responsible citizens of our country, we have to ensure that eyesight is our birthright and that every young future citizen has the right to see our beautiful world. We have to unite, spread awareness globally, and see that prompt, timely referrals are made and appropriate actions are thus warranted. Join hands with Arvind's ROP SOS team in their mission to eliminate this cause of needless blindness. As volunteers, refer premature babies to the pediatric retinal specialist at Aravind Eye Hospital, Coimbatore, or easier still, ROP tele-screening at gmail.com. Let every little eye shine with love, happiness and joy.